Asian and had upper and lower bleph. Is it possible to lower my eyelid crease? It's been 11 days since my upper and lower bleph, and I am very unhappy with the upper eyelid result. I originally just wanted a lower bleph to remove the dark circles. My doctor recommended I also do upper eyelids to remove the excess hooded skin. I am 43 years old and had Asian double eyelid surgery 25 years ago. Even though there is some swelling, I believe the incision on the upper eyelids are way too high for my Asian eyes. I've been researching for an eyelid specialist to have a revision.
Thank you for your question. You have submitted some photos after undergoing Asian eyelid surgery 11 days ago. And although you acknowledge in your question that you know that there is some swelling, that you already believe that the eyelid crease incision is too high. So certainly you're entitled to at least have a concern. It is probably a little too early to start seeking advice for revision surgery. You see, Asian eyelid surgery, once you have relative amount of experience, the principles are basically straightforward. Understanding that Asian eyelid crease is a little bit lower, there has to be a fold, and that the position of that crease is typically several millimeters lower than an Occidental or Caucasian crease. Now, one of the things that gets people very nervous in the beginning is swelling that causes an artificial widening of the crease. You see, the eyelid platform is what you're looking at, and you're interpreting that the crease is too high. Now, what generally happens is that with time, and we're talking about eyelid surgery can take several months to even a year for swelling to completely go away. But generally, people start to notice an appreciable difference from the first week at about 1 month and 3 months. So you can just compare those photos to get a sense of what's going on. Now, there are times where the crease can be artificially too high if additional more fat was removed and there's a little bit of a hollowing process. But in terms of the actual crease placement and the fixation, to just understand what Asian eyelid surgery is basically when someone does not have an eyelid crease or has a single eyelid or a monolid. There are certain things that I look at in order to determine what type of eyelid surgery to do. The first thing I look at is there excess skin? That gives me the decision-making point of making a decision on whether or not to do an excisional procedure where a strip of skin is removed, or a non-incisional procedure where we're actually making little openings in the skin and anchoring the skin to a particular muscle called the levator muscle. And the levator muscle, like the word elevator, it's the muscle that's responsible for lifting the eyelid and creating a crease in that way. Some people of Asian descent will actually almost create an artificial technique where they'll actually place tape and create this artificial crease that tends to work pretty well in some people, but eventually a lot of people get frustrated with the continuous application of this tape. Now, the other parts of the equation is there fat, and is that fat responsible for obliterating or making it difficult to have a proper crease? So, with those factors understood, I make a decision about whether or not to remove skin and how much fat to remove at the time of surgery. But the common thing is that we are creating an adhesion or a connection between the eyelid skin and the levator muscle. So I think that at this point you certainly can get additional opinions, but I think that most people you go to will say to you that you have to wait. and you have to wait to allow swelling to go down, because no one's going to want to intervene in a situation where there's tissue swelling. I always tell people who come to me with similar situations that if I were to go in while the tissue is swollen, I'm working on a moving target, and I can't do very accurate surgery when things are very swollen. There are, in everything, exceptions to the rule, but in a general basis, when there's no evidence of infection or any type of unusual inflammation, there is no reason to try to go in while tissue is just so early in the healing phase. Now, there is some timing that is helpful, and sometimes I'll wait just until enough swelling has gone down to go and do a procedure, a revision. Now, not necessarily Asian eyelid surgery, but other eyelid procedures, because I want to minimize the amount of scar tissue formation. But then that is determined on a case-by-case basis. So I think that really what you need to do is talk to your doctor. Stay in communication with your doctor, follow up, and if you made your decision to have this doctor do your surgery, most likely you were impressed enough that their doctor had experience with Asian eyelid surgery, and so I wouldn't say to just abandon all hope at this point. So I thank you for your question. I hope that was helpful. Thank you again.